Hypertension Awareness Series Episode 13. Good morning. Today we learn about non-modifiable cardiovascular risk factors, understanding your baseline risk. This is a gentleman I met in my office 1 month ago. He was 42, slim. He exercises 3 times a week, and he came because he had noticed over the previous month his pressure had been elevated. Repeated BP readings 155/82. And he said, "Doc, I don't understand. I eat well, I exercise." And I just asked one question. "Please give me your family history." And he said, Dad had stroke at 54 and died 2 years later. His uncle currently has hypertension and kidney failure. His older brother, who is 48, started pressure medications the year before. And suddenly, this was not random. This was a pattern. Family history is not small talk in the clinic. It's a cardiovascular roadmap. And early warning saves lives. You may not choose your genes, you may not choose your age, but you can choose how you respond. And today we learn about the non-modifiable cardiovascular risk factors that you must know. What you cannot change, but you can act around it. And understanding these factors allow earlier screening, stricter targets, and smarter prevention and aggressive lifestyle modification. Number 1 is your genetics and family history. This is often the most underestimated risk factor. Hypertension is polygenic. It is influenced by multiple genes that affect sodium retention, salt sensitivity, your renin, angiotensin, aldosterone system regulation. It also affects your vascular tone and endothelial function and sympathetic nervous system. If you have had a family history of diabetes, hypertension, a parent who gets stroke early below 55 years, a sibling with hypertension diagnosed early, relatives with chronic kidney disease linked to hypertension, or any sudden cardiac death in your family, your lifetime cardiovascular risk rises significantly. Family history does not just increase your high chance of blood pressure, it also increases the risk of stroke, heart failure, kidney disease, and premature cardiovascular death. You can inherit your vulnerability, but you do not inherit the outcome. Your family history you cannot change, but you can change your lifestyle. You can change how you act. So number 1 is your family history, genetics. Number 2 is your age. As we age, as our ages increase, our arteries stiffen, systolic blood pressure rises, and vascular compliance declines. And after the age of 40, your cardiovascular risk increases. After 60, it gets even much higher. Aging is inevitable, but your lifestyle is your choice. You cannot change your age, but you can change how you act. Gender is another risk factor, especially the male gender. Men tend to develop hypertension earlier, and they experience cardiovascular events at younger age. But after menopause, the women catch up and the risk rises. But prevention must be lifelong. So men for earlier age and women catch up after menopause. The non-modifiable risk factor 4 is ethnicity. Individuals of African descent develop hypertension earlier. They often have higher BPs, and there is increased salt sensitivity and higher rates of stroke, heart failure, kidney disease at an earlier age. You cannot change your ethnicity, but lifestyle is in your control. Knowing your baseline risk calls for earlier screening, lower treatment thresholds, aggressive risk factor control, and global cardiovascular risk assessment. Prevention must be personalized. Your genes load the gun, but your lifestyle pulls the trigger or protects the trigger. When you know your father had a stroke, your uncle or relatives have kidney disease, your other siblings have hypertension, you cannot be casual. You need to act. Reduce salt intentionally. Be active. Move daily. Maintain a healthy weight. Monitor your BP regularly and start treatment early if indicated. Assess your kidney function. Check your glucose and your lipids. And this is a discussion we had in the office with the 42-year-old gentleman. Assessed his overall cardiovascular risk, and we started medication. You cannot wait in such a person with a strong family history. The father had a stroke at 54 and died at 58, which is a very early age. Remember, knowing your baseline risk guides you to take action early. Even when your risk factors are non-modifiable, family history, genetics, age, ethnicity, you can act on your lifestyle. Early awareness leads to early detection. It leads to disciplined lifestyle choices and consistent follow-up to reduce your risk of stroke, heart failure, kidney disease. You are not powerless. Once you are informed, you can make healthy choices. So let's discuss. If you are over 40 years, are you checking your blood pressure at least once a year? Do you also know your family history? What is your baseline risk? Have you asked about your parents, about your blood relatives, if there is any history? And if you have that history, what action have you taken to lower your risk? Remember, genetics load the gun, but your lifestyle choices pull the trigger. The fact that you have a strong family history of cardiac disease does not mean that you will get. That's why in a family you'll find some will develop, others will not. But understanding your lifestyle, your baseline risk makes you be more aggressive on your lifestyle modification. It makes you be more aggressive on early screening. It makes you be more aggressive on treatment, so that in the gentleman who is 42 with hypertension, with a strong risk of stroke, kidney disease, sudden death, cardiac death in the family, you need to act fast. You do not have the luxury of wait and see. Understand your baseline risk so that you can act. Stay tuned for our next episode, where we shift gear to the investigations to be done. Once you are diagnosed with hypertension, what next? What baseline investigations must be done if you have hypertension? Dr. Beatrice Muthui-Mutua, saving lives one heart at a time.